So skin disease, probably the commonest reason for going to a GP after pain. And sometimes it's an add-on. You know, you've dealt with the hypertension, you've dealt with the arthritis, then while I'm here, doctor, would you have a look at my skin? And it's difficult to do that in a very short consultation. We don't know really how much skin disease is out there and what the balance is. The last unselected population study in the UK was 1976, called the Lambeth Study, to dermatologists. And this was doctors and nurses from the dermatology department in St Thomas's Hospital went out into the community asking about skin disease and examining those who said they had skin disease. And it's fascinating compared to what I see now. This was all eczema and dermatoses, prurigo, generalized itching, a little bit of acne, and this is in the oldest age group. Nothing in there about skin cancer. This is my personal list, the commonest skin problems I see. We've got lots and lots of skin lesions. When I started in dermatology, probably about a third of the referrals were for skin lesions. Now it's about 70%, much more awareness, but also an increased incidence as well. I see a lot of itching with no rash. I see lots of rashes as well, including the blistering ones. We see lots of problems with legs. We see a little bit of the infestations and infections. On the skin, as I say, it's subject to lots and lots of insults. Chronologically, we get older. Physiologically, we age at different rates. Pathologically, skin will age, but also we've got the external influences such as sunlight and irritants and so on. So who's susceptible to photoaging? Well, obviously the people that go off to Spain for 3 months at a time and love sunbathing, but also people who never sunbathe, but they work in the garden in all weathers. He's quite well protected, actually. He's even kept his natural protection up there, which is great. But these chaps here, working on a building site, no shirt, always look at their backs. They will eventually, almost all of them, will develop at least superficial basal cell carcinomas. It's now an occupational disease, and most building firms will now make it very strict, health and safety, keep your shirt on. But you still see them, don't we? And of course, smoking makes it worse, as it does most things. So the visible changes, appearance-related concerns, not high on the list with the frailest elderly, but this is what we see, of course, the wrinkling and sagging and thin skin, apart from the soles of the feet, it tends to get a bit thick and crumbly. Skin loses its elasticity, and you can test that for yourself. You can almost tell how old people are, not by looking at their teeth, but if you tent up the skin on the back of your hand and let it go, how quickly it pings back. You might want to try it. It determines how old you are. Mine's much older than I'd like. And of course, there's the dryness and this loss of luminosity, the general appearance like that. But also, good news, baldness, grey hair, increase in nose and ear hair, nails change quite a lot, fingernails get thinner and toenails thicken, and there's different patterns of disease and lots of skin lesions. And here's the sort of thing we're all well used to noticing, these comedones on the face, not due to acne, of course, but combination of sunlight and often smoking. Pigmentary changes, these little things you'll see in lots of old people's faces if you look for them. They look a little bit like basal cell carcinomas, but they're tiny and they've got this punctum, and these are just enlarged sebaceous glands. Longitudinal ridging in the nails is physiological. This is not pathological unless it's discolored, but transverse ridges usually are pathological in some way. And here's more of the solar comedones. In combination with smoking, you get them very severely, and it's got a fancy name as well.